During the procedure, they popped a blood vessel in my face.
You can see here there's a lot of swelling. This is a fox eye thread lift procedure. The purpose of this is to hitch the eyebrow up so it creates more of a straighter eyebrow and also helps to create that kind of really snatched appearance that all the girls are talking about. The swelling here, I mean, there's a chance they've hit a little vein there, and you can see that swelling just above the eyebrow there. Quite distressing for her, I'm sure.
I didn't know that that had happened, but later on I found out that that was what happened.
I'd imagine a lot of this as well is actually swelling. We put a lot of local anaesthetic in before this procedure, and I mean, I would put up to 10 mils of local anaesthetic. So if you think of filler, we're putting 1 mil in the lips. I'm putting 10 mils of a fluid in there for the purposes of pain relief. So you can look like a bit of an alien in the short-term period. I'd expect that to last a few hours.
Jessie's fox eye thread lift procedure ended up turning into her biggest regret.
So you can see there's a little bit of redness around the entry points. The threads, they are a foreign body. And if the practitioner hasn't been careful when placing the thread, they've introduced some form of infection. You can see on both sides, there's signs of that. It can be pretty disastrous.
That caused me to blow up like Megamind. There's another photo of it. They were like, oh no, this is completely normal. Your swelling will go down in like a week's time.
Look, I've got to say some swelling is completely normal with this procedure. It's one of those procedures where I don't do a great deal of them anymore because there's a very specific niche of patients that this works well for. If you've got a really heavy brow, it's probably not the best. There is a lot of swelling, there's a bit of downtime, it's kind of expensive, and there's a bit of pain associated with it as well. So you've got to really, really want this result, and you've got to be a really good candidate for it. And it can be a few days of swelling.
In total though, I think I was a balloon for about like 2 weeks or 2.5 weeks.
Just keeps getting worse and worse for this poor girl. I've seen these get bad where the actual swelling comes down and they can hardly open their eyes. It's, I feel for the girl, and you can see it's actually come under her eyes as well.
This was the 3rd day, I'm pretty sure, because I went back in for a quick checkup.
You can see, so that's probably, the first one would have been day 1 after the procedure. This would be day 2. Day 2, the swelling's always the worst. And typically it peaks around here and then it'll drop off.
During the 2nd week, I started noticing bruising on my left eye, which is the same eye that the blood vessel popped off.
The swelling eventually went down, but then Jessie noticed that one brow had dropped.
It actually doesn't look too bad there in the initial part. I think the result's pretty good. Here's another risk that I explain to patients, that this procedure, sometimes there's a percentage chance that one of them drops or both of them drops. So again, it's a very specific niche of patients that this is a good treatment for. You don't want to have your injector or your doctor going to put this in without properly assessing it.
The same thing then happened to the other one, meaning she had no fox eye lift results at all.
You'll hear a lot from people that the fox eye result, oh, there'll be collagen stimulation, blah, blah, blah. It's all rubbish. None of that stuff works. There'll be a tiny little bit, but this is a heavy part of the face. So if someone tells you, oh, you're gonna wait for the collagen stimulation, it's complete rubbish. This is a result that works with the thread hitching the brow up and no other way.
And the threads started to poke out of her face, so she needed to have them surgically removed.
If you guys can't tell, I got my threads removed.
So this is a principle of surgery. Any foreign body in the body that gets infected must be removed. There is no way around. If you had a knee replacement that got infected, it has to come out. If you had a tooth implant that got infected, it has to come out. Because what happens is that for you to use antibiotics, the blood flow has to get into wherever the infection is. And if the infection is sitting on the thread, well, there's no blood supply to a thread. So there's no way of getting antibiotics to it. And what will happen is you'll reduce the infection to a little bit, and then the minute you stop the antibiotics, the infection will become really aggressive again. It's very technically challenging to remove these and can be quite traumatic to the skin.
My face currently looks like I've got 2 golf balls on them, but it's fine.
Some of the threads had already dissolved.
So these threads, they probably last in the body 3 months. There are different types of threads. Some are made of a substance that lasts for 3 months. Some are made of a substance that lasts up to 18 months. I never advise getting threads that are permanent because they always usually end up in some kind of autoimmune reaction where your body sees it as foreign and attacks them. I've seen a lot of problems with those.
So they removed the ones that they could and stitched it up.
And this is me now.
I find it interesting. I don't think they would have stitched this up. Normally, the other thing we do is we never stitch up after an infection. We let it drain out, because if we were to put a stitch in it, any infection that's still left over will typically just build up again. So I'd imagine they'd make a little slit there and allow any pus to drain.
So my fox eye thread has turned blackish, which is very concerning. So I have come to my cosmetic surgeon.
So this black that's happening here, you can see she's of a darker skin type, and these people are more prone to something called post-inflammatory hyperpigmentation. So it's a pigment that follows trauma. She's had some trauma to the skin, and she's got quite nasty PIH, or post-inflammatory hyperpigmentation there.
Which I thought I was never going to come back to again.
And as I said before, the threads are very hard to remove surgically. They're almost impossible to see. And I wouldn't be surprised if a tiny little bit of thread's been left behind. She mentioned that they'd been dissolved, and she might have a tiny little bit here that's causing an inflammation that's persisting and causing the draining and redness.
And he's going to have a look at my threads and hopefully let me know what's happening. He put a steroid injection into the area. I think that lightens the scar.
So steroid injections we usually use for a scar that is raised. I mentioned she's got a darker skin type. As you kind of move along the spectrum from a lighter skin type to a darker skin type, your risk of developing something called a keloid scar, a raised scar, is higher. The purpose of the steroid injection is to reduce the inflammation and make that scar a bit flatter. It probably won't do a whole heap with the pigmentation, although there is a side effect of removing the pigmentation completely with the steroids. You have to be very, very careful. You have to know what you're doing.
And also helps with how the scar is currently progressing.
So it's been a couple of days since I got the steroid injection, and from what I've noticed, it's taken away all of the inflammation.
I wonder if she's had the steroid injection. The other thing I'll say about that is that you got to be very cautious with this, because steroids, we're trying to flatten, and one of the risks are you can overdo the steroid injection. It's very hard to judge how much to do, and you can actually cause a dip. And once you've caused that dip, there's no way of fixing it. You have to surgically cut it out. And I can see she's got an ever so slight divot happening through there. I'd also wonder whether she's on antibiotics at the same time as well.
It was a bit like out before, and now it's kind of like sunken in.
Here we go. She just said it's sunken in. So that's a side effect of the steroid. It's called skin atrophy. It's the thing we hate, especially in a young, attractive woman. That can be very debilitating, having a big hole in your face.
It's almost like there's an indent in my head now. Also notice the colour is turning back to more of a reddish colour rather than a black colour.
That reddish colour can be because the skin's atrophied so much. So what I mean by atrophy is a thinning. Hypertrophy is making things bigger, atrophy is making things smaller. The skin is so thin now that you can see all the tissues underneath. So you can probably see her temporalis muscle, that pink hue of that muscle, you can see it through the skin now. And you can also see she would have some capillary beds that run through the skin, and they're much more prominent now because that skin integrity is not intact anymore.
I don't know if it will go away because it's been like a month or so now, I think, and nothing's changed, but I'm just hoping over time it does. People have been saying that it looks like necrosis or like these other conditions happening on the thread, but the doctor has said that it isn't anything major or serious, it's just a scar.
So the things we do here is time's going to fix a lot of this stuff. I know it's going to be very debilitating for her. She's going to be she's come into this clinic to look better, and now she's probably very anxious about it, and very rightly so. She's got two very obvious things on the side of her face. There's lots of things we can do about this, but my preference for these things is to wait for a few months and let it settle as much as possible. The kind of treatment would be going forward is potentially, if it doesn't improve, to surgically excise that area that's been dipped in, or to use a resurfacing laser, or often we can put a fat graft underneath where that's gone in a little bit. So there are even fillers, there are other methods we can use as well, but it's too early to start treating at the moment.
There's no pain or anything there. It's literally like I could press on it as hard as I wanted and it doesn't hurt or anything like that.
The other nice thing about this is she's young, fit and healthy, so her skin will bounce back pretty quickly. I look at Instagram all the time and flick through, and I'm mortified at some of the ways people do these treatments. I watched one the other day of someone putting a thread in with non-sterile gloves on, cutting the thread with something that wasn't sterile. If she was trying to introduce infection, that's what she'd be doing. You've got to be very careful about who you go to. With this stuff, ask yourself, do you need it, for one? Because, I mean, this is a very luxury item that no one needs, they want. These are medical procedures, they do carry risk. And the other one is, who are you going to? Do your research. Make sure that these people have good reviews and are safe and registered medical practitioners.